to function, that your organs actually began to form. So now here's your brain. It starts to function now. You start getting the heart, the lungs, the stomach. So what's controlling all of your organs? Your brain. So that's not rocket science. You understand that. And so how does your brain get the messages to the organs? It has to send the messages through the nerve system. And so if I cut, excuse me, if I cut one of your nerves, what happens to your organs? Your organ dies immediately. So you guys have to understand this. If I cut a nerve, your organ dies. So let's say I get in there and I start blocking the nerve. If I put a little bit of pressure on the nerve, what happens to the organ? It obviously doesn't work properly, right? And so now you start to develop your symptoms. So now your blood pressure starts to go up. Now your allergies are bothering you. Now you get headaches all the time. Now you got stomach problems and you have menstrual cycle problems and all these things. Where's it coming from? Because what do the doctors do for you at that point? Well, they're going to look where? Where your doctor's going to look? They always look at your organs. You guys have to understand that. Your doctors don't look at your nerve supply. They treat your symptoms at the organ level. And so then you wonder why you're not healing. Because if we can facilitate the healing, if we get pressure off the nerves, guess what happens to the organs? They immediately begin to heal 100% of the time. So this is something that the doctors have never explained to you, that if your nerves, if your brain can communicate with every cell, tissue of your body, you will be healing at a cellular level. That's health. And unfortunately, you're waiting around to get sick to take care of yourselves. Now your organs are failing, and guess what you're doing? You're taking medications, which are proven never to work. I mean, they will save your life in a crisis, but they never get the body healing again. That's why you're here tonight, because we get the body healing. We listen to God in this office. We do not take credit for the body healing. We know that God created us perfectly to heal, but if your body's not working the way it should, it never will heal, and God will not get the credit that He deserves. That if your body was working absolutely perfect, you would never get a cancer, you would never get heart disease. Would you get a symptom? Yes. I mean, you guys still see, you're going to get symptoms when your body's working properly, okay? If you ate salmonella tonight, what do you need to get tonight? Diarrhea tonight, okay? You have to get vomiting and diarrhea. Is that an intelligent or non-intelligent of the body? Intelligent. But then now all of a sudden we're vomiting and we have a fever and we feel like crap, and guess what we're going to do? We're going to lower the fever, we're going to stop the vomiting, and guess what's going to happen to the salmonella? It's going to prevail in our body. Do you guys understand that? So you guys have to understand, I feel lousy right now. But guess what? I'm going to get my adjustment, which I already did today. I'm going to make sure I'm going to be my immune system's going to be at its peak. I'm not going to bombard it right now with pastas or anything like that. I'm just going to eat some vegetables, and I'm going to get my rest. But I know for a fact that I'm happy that I have this right now, because I will never get it again. My body's created an immunity towards it, and I'll never have to worry about getting this exact strain again. And so that's what we're looking for, the TH1 or the TH2. TH1, you guys understand that? So now we don't ever have to worry about it. And so our upcoming talk, or our upcoming events in the office, you guys will see that I'm always going to pay it forward. I'm always going to pass you the lifesaver, because you know people that I don't. And so the way that I appreciate my patients and the way that we get this message out to the rest of the community is we pay for all the exams, all the x-rays. All you have to do is get checked. You do not have to become a patient here. You don't have to pay a single dime. We cover that. What we're going to do is the most amazing testing, because we're going to check out to see exactly if the nerves are blocked. If they are, you're going to need an x-ray. How much are x-rays usually? Pretty expensive, right? We're going to cover those. Okay, so you don't have to pay a dime. All you need to do is ask someone or tell somebody, listen, this is what this place is all about. Because you guys can see, this place should have been full. How many people need to hear this message tonight? So we're going to have to do it again come October, because it's just going to be bombarded. You guys will see, we have signs everywhere. Get your flu shot, get your flu shot, get your flu shot. And I shouldn't say this, but I take those flu shot things off and I put them in my pocket and I take them with me, because if I can stop somebody from getting a flu shot, that's my way. I mean, you guys, honestly, I'm not going to tell you to do it, but do it, okay? Start taking those flu shot vaccines. Because honestly, I don't get anything if you don't get your vaccines. I don't get anything. But I know I can stop what's happening in my family right now. If most of you guys don't know, and I don't mind telling the story, and I don't think he would mind, that my brother-in-law, 35 years old, he was in incredible health, he thought. He had one of those jobs where they got the flu shot every year. Okay, the flu shot came in, so he thought he was doing what was right. Flu shot, flu shot, flu shot, flu shot, flu shot, flu shot, flu shot. 7 consecutive flu shots. How many micrograms of mercury in every flu shot? 25 micrograms. So was one flu shot bad? Did he get sick after one flu shot? Well, he didn't get the symptom. And so it just kept compiling, kept compiling, kept compiling. And what happens to the bucket? It's now overflowing. Now he's got ALS. My sister is having her first child, which is incredible. And yet he's losing all of his weight. His symptoms are taking over his body. And who knows where he's going to be in 2 years. And so this is hitting home for me. And you guys, I do not want it to happen to your family. Because when it does, it feels like crap. And then what do? You just sit there and are like, oh, you shouldn't take your flu shot. Listen, this is more than that for me. I will run and jump in front of somebody's car before they go and get another stinking flu shot. Because if it happens to you, it'll kill you. And so now this is what's happening in my family. This is more than a job. You guys have to understand, you have to get this message out. Tell people. It's on Facebook. It's everywhere. YouTube. Just Google search swine flu shot. I mean, all these, I could have put up 50 different things that could have came out here. I could have put up 50 different videos, and you guys will see it's everywhere now. This isn't, yeah, we might be like kooky because we're sitting here telling you the truth, but I don't get anything. I'm not financially vested in this. Do you guys understand? If you don't vaccinate, what am I going to make out of it? It's nothing. It's for your own good to understand that you want the flu. If you get the flu, it's good actually for you. Okay? So you're going to, but it doesn't feel good, but I will take the flu that won't kill me, that I'll just stay hydrated, I'll get over it in a couple days, over what now my brother-in-law is dealing with. Do you guys understand that? And so now these things are deadly. The Guillain-Barré syndromes are deadly. The Alzheimer's disease. Who wants Alzheimer's at the end of their lifetime? Quickly go to your senior citizen community. They don't even know who they are. They didn't think it was going to happen to them. But guess what? Guess what the government knows? That are these people going to say no to a flu shot if they go to an old folks home? Are you kidding me? They're going to wheel on over there. It's something new today. And they're going to get a flu shot. Because they're never going to say no. Do you guys understand that? So they're preying on these people. They're preying on pregnant women. This is nuts. So you guys have to understand that. This is not just me. You guys have to get out there and you got to tell the word because no one knows what you guys know now. And so tell the word, tell the story, stay healthy, keep your families well, refer people to the office, whatever I can do to help, that's why I'm here. Okay, so I'm losing my voice. I'm going to close it up with, go ahead, Donna, one quick question. Oh yeah, did you guys see that?
They present a bill that was going to be required with a $1,000 fine.
Every day.
And they will come to your home if they have to, without a warrant, to check your home. And Obama's trying to do that
for the rest of the country. Do you guys see that? If you refuse the flu shot, they're throwing them in jail. Okay, so that's not here. So before you mercury poison me, you're going to get lead poisoned on my front door. Okay, so you guys have to understand that you have rights, that these are just recommendations. I have all, that's in Massachusetts, thank God. If you're there, get out. Honestly, I will move to Guatemala if I had to, if it comes here for me and my children. But you have to understand that you guys all have rights, that I have exemption letters. All of your children can go to school without getting vaccinated, just to let you know. You guys all can go. Your kids can go to school. All of our kids go to schools without getting vaccinated. They just need to have an exemption letter. And it's really simple to type up, and no doctors can argue with it. No doctor. So the question is, you have to understand what you're doing when you go to the doctors. The girl who works here, my CA Noelia, she went and brought her kids in, and she was so scared because they're just throwing out, you're just a bad mother. What do you mean you're gonna leave your kids susceptible of dying of this, dying of that? It's scary. Trust me, I understand where you guys are coming from. But when you read this stuff and you're completely armed, they will back down immediately because they don't know what you know. Okay? All they know is what's being taught to them by these companies. Do you guys understand? So that's all you need to know is, all right, do you know that there's 25 micrograms of mercury? Well, we took it out, now it's thimerosal.